So 6, 7 questions came from forensic medicine, and all the questions were from the PYQs only. Yeah, all the questions were from PYQs, but they were asked in a bit unusual manner. Okay, so let's discuss. I think this was a very straightforward question that Marshall's triad is seen in. This is a very, very straightforward. We all know the answer is secondary blast injury. And what is Marshall's triad? It is a triad of multiple small abrasions, lacerations, and contusions all over the body. This is the most common cause of death in bomb blast injury. Okay, multiple small abrasions, lacerations, and contusions are seen all over the body, as you can see in this photograph. Okay, now let's go to the next question. Which of the following is incorrect about heat exhaustion? Loss of thermoregulatory mechanism, orthostatic hypotension is seen, altered consciousness, core body temperature less than 105. So as we know, there are 4 kinds of heat injuries. Number 1, heat cramps is the mildest form, and as we go below, the intensity increases. In heat cramp, there is only cramps plus sweating plus pupil dilation. In heat syncope, there is above plus decrease in BP plus decrease in BP leading to fainting. And in heat exhaustion, there is above plus some increase in body temperature. Heat stroke has a very different features. It has very high body temperature, more than 104 degree Fahrenheit, and there is absence of sweating, okay, and pupillary constriction and mental disturbance. So if you go by this, because in heat stroke, there is actually a complete failure of thermoregulatory mechanism. Thermoregulatory mechanism fails in heat stroke. So now if you go here, loss of thermoregulatory mechanism, no, it occurs in heat stroke, not in heat exhaustion. Hypotension, yes. So please, hypotension, in fact, hypotension starts occurring from heat syncope itself. Okay, so hypotension will be there. Altered consciousness, this is a tricky step. Actually, altered consciousness is more of a feature of heat stroke, but we have to core body temperature less than 105. This is also correct. So some students would have got confused between this choice, the first one and the third one. But if we have to choose the best possible answer, the best possible answer will be A, loss of thermoregulatory mechanism, which is the classical of heat stroke. Altered consciousness basically occurs in thermoregulatory, but little bit it can occur in heat exhaustion also, like because there is fainting is there, so little bit it can occur in that also. ये examiners में इतनी बुद्धिमानी होनी चाहिए कि कम से कम नॉन एम्बिगुअस चॉइसेस दें, बट अब दिया है, ये ऐसे ही होता आ रहा है, सदियों से ऐसे ही होता रहा, सो कुछ कर नहीं सकते, आपको बेस्ट पॉसिबल आंसर चूज करना है. ये लपड़ झंडू तरह के चॉइसेस आ जाते हैं, इसका कुछ कर नहीं सकते, आने नहीं चाहिए, बट ठीक है. ओके, ऑल्टर्ड कॉन्शियसनेस नॉट सीन वाज द ऑप्शन. अच्छा ठीक है, ऑल्टर्ड कॉन्शियसनेस नॉट सीन वाज द, फिर तो कहानी खत्म, फिर तो कोई दिक्कत नहीं है, फिर तो ठीक है यार, फिर तो एग्जामिनर ठीक है, फिर तो ठीक है, फिर तो उनका शब्द वापस लेता हूं, फिर तो आंसर इज ए, स्ट्रेट फॉरवर्ड आंसर हो गया. ठीक है, चलो नेक्स्ट क्वेश्चन. अ बॉय वेंट टू school and consumed some unknown substance. He came to emergency department with pulmonary edema and silver nitrate test. अब इसका है तो ये PYT में से एल्यूमिनियम फॉस्फाइड इज द डायग्नोसिस, बट सिल्वर नाइट्रेट टेस्ट कोई कॉमनली तो करता नहीं है, सो अननेसेसरी दिस क्वेश्चन वाज आस्क्ड. आई मीन क्वेश्चन इज आस्क्ड व्हिच डज नॉट हैव मच क्लिनिकल रेलेवेंस. So actually what happens is the silver nitrate combines with aluminium phosphide to form silver phosphate, and the silver phosphate is black in color. Silver phosphate is black in color. So if this black color is formed, this gives us the diagnosis of aluminum phosphide. Now, aluminum phosphide basically inhibits, it has two mechanisms. It inhibits cytochrome C oxidase and it leads to oxidative stress. Oxidative stress. So basically, it affects all body systems. It affects all body systems. So sign and symptoms are very non-specific. A classical sign is there is a very extreme hypotension. Extreme hypotension is there. So main diagnostic feature which is coming here is the silver nitrate test. Now, what's the treatment? Now, if you ask about the treatment, there is no antidote. There is no antidote. Treatment is mainly supportive. Treatment is mainly supportive. But yes, some books say that magnesium sulfate can be given in aluminum phosphide poisoning. Why? Because aluminum phosphide poisoning leads to hypomagnesemia. It will correct it. And secondly thing is magnesium sulfate, it competes with the calcium ions, because of which it stabilizes the cell membranes. And stabilization of cell membranes reduces arrhythmias. Stabilization of cell membrane reduces arrhythmias. पर मैं इस क्वेश्चन को कोई बहुत समझदारी वाला क्वेश्चन नहीं कहूंगा, because neither silver nitrate test is commonly done nor magnesium sulfate is like a main treatment. But if it has been asked, so here one thing which is coming is that questions are not coming from rare poisons. Questions are coming from previous year topics only. But in previous year topics, they are going very in depth. They are going so in depth that even if something is not relevant nowadays, they are asking it. तो ये थोड़ा लपट झंडूस वाली बात चल रही है कि क्वेश्चंस आर बीइंग आस्क्ड फ्रॉम पीवाईटी. पीवाईटी इसके एकदम अंदर घुस जाना है, उसे छोड़ना नहीं है, बिल्कुल पकड़ के रखना है. जो चाहे काम की चीज नहीं भी है, अगर वो पीवाईटी है, चाहे वो आज क्लिनिकली रेलेवेंट नहीं भी है, इवन देन दे आर आस्किंग इट. सो मैग्नीशियम सल्फेट इज द आंसर. ओके, व्हाट इज सेइंग बाल वाज देयर इंस्टेड ऑफ. ओके ठीक है, इसको काट देते हैं. एनी हाउ बाल कैन नॉट बी द आंसर. नो, ब्रिटिश एंटील्यूसाइड इज अ चिलेटिंग एजेंट. British antilucide will be used for chelating heavy metals. Here the diagnosis is aluminum phosphide. Diagnosis is aluminum phosphide. So whether the choice was Bal or Prussian below, the answer will remain magnesium sulfate. क्योंकि otherwise तो इसका वैसे as there is no antidote for aluminum phosphide poisoning, but magnesium sulfate is supposed to have some benefit. ठीक है, understood? चलो, सब्सटेंस, ये भी एक फालतू तरीके से पूछा गया क्वेश्चन है. अ ब्लू कलर सब्सटेंस, दो इट हैज बीन टॉट इन माय क्लासेस दैट कॉपर इज क्लासिकली ब्लू इन कलर, बट ये कोई पूछने का तरीका थोड़ी ना हुआ. देयर कैन बी हंड्रेड्स ऑफ थिंग्स व्हिच कैन बी ब्लू इन कलर. सो ये भी कोई समझदारी वाला क्वेश्चन नहीं था, नंबर वन. एंड सेकंड थिंग इज historically, if you ask me, what is the treatment of phosphorus poisoning? Now, phosphorus has four. So remember two things, KMnO4 and CuSO4. Both have four. They are used in treatment of phosphorus that I have been teaching you in my classes. Now, but CuSO4 reacts with phosphorus to form cupric phosphide, which is non-toxic. But this was used only historically. Nowadays, nobody uses it. Because copper sulfate itself is a poison. तो ये भी एकदम लपट झंडूस की तरह क्वेश्चन पूछ लिया, कोई मतलब नहीं है. फर्स्ट ऑफ ऑल दे आर शोइंग अ ब्लू इमेज, और ब्लू इमेज कैन बी हंड्रेड्स ऑफ थिंग्स, बट स्टिल दे आर आस्किंग इट. सो जस्ट रिमेंबर, ब्लू कलर इज क्लासिकली एसोसिएटेड विद कॉपर. एंड okay, so this is actually copper sulfate. Blue vitriol, also called blue vitriol. And then for treatment of phosphorus, it has four. So KMnO4 and CuSO4 the treatments. So answer is phosphorus. So basically they are asking PYTs, but in PYTs they are going into even those things which are not of relevance. चलो भाई, अब कोई जैसे कर रहा है. Which of the following does not inhibit cytochrome C oxidase? So here you remember one thing, that these are the poisons which inhibit cytochrome C oxidase. Cyanide is the classical inhibitor of cytochrome C oxidase. That is the complex 4 in the respiratory chain enzyme. Now, aluminium phosphide, it has two mechanisms. It inhibits cytochrome C oxidase, and it also causes oxidative stress. Hydrogen sulfide, it also inhibits cytochrome C oxidase. And carbon monoxide, the carbon monoxide's main mechanism is formation of carboxyhemoglobin, but it also inhibits cytochrome C oxidase. Okay, additionally, it also inhibits cytochrome C oxidase. So here, if you think the answer is nitrous oxide, the nitrous oxide's main mechanism is it deactivates vitamin B12 by oxidizing it. ठीक है? और कोई confusion, कोई समस्या? Please tell me if I am missing something, because these are all recall questions. Answer is nitrous oxide here. And I think there was one more question on some antidote and drug, where for benzodiazepine it was flumazenil classical. For delirium tremens was given delirium tremens. For delirium tremens, you will classically use something CNS diazepam, something like that. I think oxazepam was there in the choice. Oxazepam was given in the choice, and then something something on alcohol dependence, etc. I don't remember the exact choices, but something was there. Flumazenil, delirium tremens, oxazepam, and I think for alcohol dependence something was there. I don't have the choices. Okay, and then I think there was some question on chemical injury to eye. Chemical injury to eye. Now here the choices were taking history. ये महालपट झंडूज वाला चॉइसेस दिया गया. दूसरा कॉपियस इरिगेशन विद सेलाइन, और फिर था आईओपी असेसमेंट. दूसरा था शायद विजुअल इक्विटी असेसमेंट. So here also this is a lapad jandus question. Why? Because see, IOP and visual acuity, we know this will not be done. The problem is history taking or copious irrigation. Now this is a very, see, normally somebody can argue if the patient comes, first step is to take history. So somebody can say A is the answer, but then somebody can say chemical injury was also already given the choice. So straight away start giving copious irrigation. So to be very frank, in these kind of lapad jandus questions, we don't know what the lapad jandus examiner would have thought is the answer. He might have considered A as the answer. He might have considered B as the answer. Anything can be the answer. There is nothing like a right answer here. So don't waste your खोपड़ा on this. Exam खत्म हुआ है. फालतू क्वेश्चन का, एम्बिगुअस क्वेश्चन का कोई सही आंसर नहीं हो सकता है. दिस नॉनसेंस क्वेश्चंस था, ये नॉनसेंस चॉइसेस था. ठीक है? एनीथिंग एल्स वाज देयर? चलो ठीक है, लगता है सब थक गए हो अब.